the last session that we are going to look at under the endocrine system, we are looking at disorders of the gonads. And so the session overview, this session is the last part of the course, which looks at the disorders of the gonads, and then students are taken through the structure and functions of the reproductive system. So the session objectives, at the end of the session, it is expected that the student should be able to appreciate the functions of the reproductive system and then explain the basic regulation of the FSH and then LH discharge, as well as the function of the GRH. And so disorders of the gonads, straight to the point, I have provided the notes for you. We have the vaginitis, and this is the inflammation of the vagina, and there's a variety of conditions that causes vaginal and sometimes vulvar symptoms such as itching, burning sensations, irritation, odor, and then vaginal discharge. In especially, we talk about the females, and then we have the vulvovaginitis, which is the inflammation of the vagina and the vulva due to anatomical location. And then the etiology, the most common cause of vaginitis are bacteria vaginosis, and then we have vulvovaginal candidiasis and then the trichomonasis. Other causes include Haemophilus vaginalis, and then the Neisseria gonorrhea, and the human papilloma virus HPV, and then herpes virus type, which we have already discussed when we were looking at the skin conditions. And so the types and the etiology, bacterial vaginosis is one type, which we have a lot of organisms that can also look at it. We have the trichomonas, and then we have the vulvovaginal candidiasis, and then we have the atrophic vaginitis. Here we have estrogen deficiency, and then the vulvovaginal candidiasis, we are looking at Candida albicans, Candida crisi, and then other types. And the risk factors, we have those with multiple sexual partners are likely to get this condition, and then vaginal douching, especially the ladies do a lot of this, and then unprotected sexual intercourse, and the menopause, and the estrogen use, and then a prolonged antibiotic use, which will kill the normal flora around this area and then give rise to attack by other microorganisms. Clinical manifestation, we have red and then swollen labia, intense itching in most cases, and then itching alone can cause swelling, and then thick white vaginal discharge is also likely to occur, and then in some cases we can have red edematous mucous membranes with white spots on the vaginal walls, and then a pain on urination, and then sexual intercourse, and then dysuria, and then other manifestation can also be identified. And the diagnosis of vaginitis. In clinical practice, bacterial vaginitis is diagnosed by the presence of 3 out of 4 criteria, and thin homogeneous vaginal discharge, and then vaginal pH greater than 4.5 is a factor, and then positive Whipps test, and then we can also look at least 20% due clue cells, vaginal epithelial cells with borders obscured by adherent manifestations, and then also preparations of gram stain can also reveal other substances. And so management of vaginitis, appropriate drug therapy is used for treating the causative organism, and usually is usually instituted. Example, for instance, we can think about clindamycin. We have the metronidazole, and then that is specific for bacterial vaginitis, and the oral and then vaginal antifungal treatment for candidiasis, for instance. In some cases we can use that. And then we have cold compresses, and then sit baths provide relief of itching, and then encourage the woman to avoid non-absorptive underwears and tight clothing, which are factors that can also promote the development of this condition. And so encourage women to keep perineal area clean and then also dry. And then another condition which is also reserved for the males, we have the orchitis, and this is an inflammation of the testicles in males, and it is generally caused by bacteria or viral infection. And orchitis most commonly develops from the progression of epididymitis, and that is the inflammation of the epididymis. And so we have the inflammation of the epididymis, and then the testis is called, we have the epididymo-orchitis, and this is the combined problem. And so etiology, we have mumps virus is the common viral cause of the orchitis, and then under 35 years mostly due to STI pathogens such as chlamydia, trachomitis, and then Neisseria gonorrhea, and then over 35 years non-sexually transmitted gram-negative organisms, especially E. coli, which is very troublesome, can also cause it. And then testicular torsion may be the origin if scrotal pain is sudden. Clinical manifestations, we have the unilateral excruciating scrotal pain, and then swelling of the testis, tenderness to palpate on the affected site, and then there may be urethral discharge, and then paresthesia, which is temperature rise, is also likely to occur. So fever in general is also likely to occur. Investigations, we can do urinalysis, urine culture, and then for sensitivity, and first catch of urine preferred to midstream urine, and then scrotal ultrasound, MRI, and then blood culture, and then sensitivity test can also be done. And then pharmacological treatment, we have the ciprofloxacin, adult 500 to 1200 milligram 12 hours for 7 to 10 days. Maximum of 10 days is very important, and so lower than 7 days is very dangerous, what can also lead to resistance. And then children, 5 to 15 milligram per kg body weight 12 hours for 7 to 10 days, which is very important. And then other drugs can also be added. Or we can have azithromycin oral, adults 500 milligram daily for 3 days, children 10 milligram per kg body for 3 days. And associated pain may be managed with diclofenac sodium, oral 50 milligrams per kg. But the diclofenac sodium, we should make sure that the patient eats before they take it. Other than that, it can cause another gastric problems. And then also ibuprofen can also be given. But we can't give diclofenac at the same time ibuprofen because of the same mechanism of action. So either you give diclofenac or you give ibuprofen oral 400 milligrams 8 hours, and make sure that these drugs you administer them with food. Bed rest, very important, and these are non-pharmacological treatment. We have scrotal support, we have surgical drainage of abscesses, and then avoid unprotected sex until treatment and follow-ups are already done, and then trace and treat sexual contacts. Don't allow them to go without treatment. Other than that, they will come and infect you again. So this is the end of our studies. We have our references. So in the nutshell, we've been looking at conditions associated with the integumentary system. We have also looked at conditions associated with the gastrointestinal system, and then the conditions associated with the endocrine system. But each of them, what happened was that we looked basically at subjective objective data analysis, and also we have also looked at the diagnostic investigations for each of the treatment or each of the conditions, and then the systems involved. And then for us to be at the safer side, we also look at the brief overview of the anatomy and physiology of each of the systems to ensure or to enhance teaching and learning. So I wish you well, and then continue to do your normal studies, and then continue to learn so that you can pass your exams. Thank you very much.